First, I want to talk about a general theme from the Seeger Tigers Conference from the first day of the Quad AI Conference. One of the things that was interesting from that conference, from multiple abstracts, was a discussion of what is the origin of the inflammation causing the disease of eosinophilic esophagitis. One thought was that the esophageal epithelium itself is contributing to the ability for food allergens to go into the esophagus and therefore lead to inflammation. The chicken or the egg argument is that maybe the food allergens themselves are causing the epithelial damage, then allowing the allergic inflammation to occur. So that was an interesting theme that happened and was discussed from multiple authors during the Seeger Tigers Conference. The next theme I want to talk about was a study out of CHOP here in Philadelphia, where they discussed transcriptional signals of milk-specific T cells that might be useful for future identification of markers of the foods that are contributing to individual patients in EOE. In this case, they were able to identify specific markers on T cells that recognized milk-specific epitopes that may be useful in the future for identifying which patients might respond to milk avoidance diets. Another study I want to talk about came out of the University of Cincinnati, which is another powerhouse in eosinophilic esophagitis research. That study was looking for the holy grail of eosinophilic esophagitis diagnosis, looking for peripheral markers that can replace the invasive use of EGDs and transnasal endoscopies to monitor for disease. What they looked at were more inflammation-specific markers that were not really correlated, but then they looked at more broad-based typical markers that are easily found on blood counts from absolute eosinophil counts, absolute basophil counts, absolute neutrophil counts, and those counts were moderately correlated with disease activity. Another study that was interesting was looking at the effect of dupilumab in treatment of EOE, looking at the effect on specific IgE to food allergens. It significantly lowered the specific food allergen IgE to the foods. However, when those patients were offered food challenges that might have demonstrated tolerance to the foods, most of the patients who had a food challenge ended up having a reaction. So while dupilumab lowered the specific IgE, it wasn't correlated with food tolerance. That study was out of Northwestern. Another study that came out looking at a 52-week efficacy for the symptoms, particularly of odynophagia, which is pain when swallowing, as well as dysphagia, which is trouble swallowing, showed continued efficacy when using dupilumab to treat eosinophilic esophagitis at 52 weeks. So that was an interesting longitudinal study, post-hoc analysis showing continued evidence of benefit at 52 weeks. One study out of Arkansas, which was really interesting, looking at dupilumab treatment failures. So dupilumab as a treatment for eosinophilic esophagitis is highly effective. In this study, they were trying to identify if there's any ability to identify who might not respond to that particular therapy. While they found 35 out of 44 patients, or 80%, responded to dupilumab with eosinophil counts going below 15 as being the definition of responders. They found 2 out of 44 were partial responders, and they found 7 out of 44, which is 14%, were non-responders. They were not able to identify any particular demographic markers that could identify who was a responder and who wasn't. What I wanted to go over at the end of that is to discuss continued unmet needs that we hope to find more studies on in future conferences like the Quad AI. One unmet need is to find more data about less invasive monitoring, whether it's peripheral blood tests that we can do to see how patients are doing. That's the holy grail, again, of EOE monitoring and even, frankly, diagnosis. So the other unmet need that we wanted to highlight is the continued search for further therapies that can be used in the treatment of patients with eosinophilic esophagitis. We have great therapies already. We need better ones. So that's what I hope to see in future conferences.